Peritoneal dialysis. Catheter is placed in peritoneal cavity, dialysate is infused for 20 to 30 minute dwell time, then clamp is removed to drain dialysate. Insufficient flow related to constipation, you would use stool softeners. You check tube for kinks, side lying position with drain bag below patient, milk tube to dislodge, and fibrinolytics such as Altepase would also be used for peritoneal dialysis. Gout, which is uric acid buildup from purines. Gout causes kidney stones and forms in the joints. Risk factors for gout include obesity, hypertension, dislipidemia, and insulin resistance. Modifications for gout include weight loss, 2 liters a day of fluids, low purine diet such as that in organ meats and shellfish, limit alcohol, and low fat diet. Fats impair urinating urates. Colonoscopy, risk for perforation and rectal bleeding. Signs and symptoms of perforation include abdominal cramping, Flatus, and watery stools. Perforation leads to peritonitis. Peritonitis signs and symptoms include rebound tenderness, guarding, abdominal distension, and board-like rigid abdomen. Tumor lysis syndrome, related to cancer treatments killing tumor, releasing potassium, phosphate, and nucleic acids. Manifestations of tumor lysis syndrome include hyperkalemia, which leads to lethal dysrhythmias, nucleic acid, which leads to acute kidney injury and hyperuricemia, hyperphosphatemia leading to acute kidney injury and dysrhythmias, hypocalcemia leading to tetany and dysrhythmias. You'll treat tumor lysis syndrome with phosphate binders, hypouricemics such as allopurinol, fluids to flush kidneys, and loop or osmotic diuretics, which are potassium wasting. Normal hemoglobin for a male is 13 to 17. For a female, hemoglobin is 12 to 15.5. Hematocrit is 3 times hemoglobin. Hematocrit for men is 45 to 52. Hematocrit for women is 37 to 48. Paracentesis, which is removal of fluid from peritoneal cavity. Complication of paracentesis is hypovolemia. Signs of hypovolemia include lightheaded, hypotension, unsteady gait, and tachycardia. There's also a risk for hypovolemic shock. Cardiomyopathy, reduced blood pumped. Cardiomyopathy has a risk for cardiogenic shock, which manifests with hypotension and narrow pulse pressure. There's also a risk for pulmonary edema. You will treat cardiomyopathy with inotropic drugs such as norepinephrine, oxygen, ECG, and cardiac enzyme monitoring. Pressure injuries. A stage 1 pressure injury would resemble a sunburn. Stage 2 would be blister. Stage 3 is full thickness to subcutaneous. Stage 4 is full thickness to muscle and bone. Unstageable would have eschar. Deep tissue injuries would be purple in color, sometimes a blood blister. Heart failure symptoms related to fluid overload. Heart failure symptoms include weight gain, 3 to 5 pounds a week, short of breath, coughing, and edema. Bilateral peripheral neuropathy. Causes include diabetes, which is most common, Guillain-Barré, which is autoimmune, and toxic neuropathy related to alcohol. Diverticula, outward pouches in the colon related to constipation. Risk is diverticulitis, which is inflammation of diverticula. Prevent with high fiber diet, increased fluids, and exercise. Head injury. Look for head injury with signs of increased intracranial pressure. Change in level of consciousness, worsening headache, visual blurring, motor problems, seizures, and nausea and vomiting. Hiatal hernia, protrusion of stomach past diaphragm. Signs and symptoms of hiatal hernia include heartburn, chest pain, dysphagia, short of breath. Avoid increased abdominal pressure, such as in weightlifting. Sleep with head of bed elevated. Stay upright after meals. Liver dysfunction. Liver synthesizes protein. You'll have decreased albumin. Liver detoxifies ammonia. You'll have increased ammonia. The liver produces coagulation factors. You'll have elevated INR. And hepatic cells will also be increased, including AST and ALT. Asthma. Triggers include pets, pollen, NSAIDs, aspirin, soap, sawdust, infections, stress, perfumes, and smoke. Asthma patients should use bronchodilators 20 minutes before activity. Status epilepticus. Risk factors include a seizure for more than 5 minutes. Seizure risk factor would include hydrocephalus with a VP shunt. Status epilepticus would be characterized by grunting and dazed appearance. The priority in status epilepticus would be stop seizure with benzodiazepines, which end in zipam or zolam, such as that in diazepam or alprazolam. Systemic lupus erythematosus is autoimmune. Manifestations vary in flares and remission. Manifestations of systemic lupus erythematosus include swollen joints, fatigue, rashes, kidney problems. Avoid UV rays and harsh soaps for systemic lupus erythematosus. It's recommended to get killed vaccines such as that in the flu vaccine. SLE manifestations include butterfly rash across the nose to cheeks, pericarditis, pleural effusion, nephritis, and deep venous thrombosis. Diabetic diet includes high fiber, low fat, low glycemic index, and low sodium. Ileal conduit, part of the ileum cut out and connected to ureters to create a urinary diversion. With ileal conduit, you want to assess perfusion. Should be pink to brick red and moist. Peripheral artery disease. Risk factors include diabetes, hyperlipidemia, hypertension, smoking, advanced age. Peripheral artery disease manifestations include weak pulse, bruit on auscultation, delayed wound healing, hair loss, capillary refill greater than 3 seconds, ischemic muscle pain, and erectile dysfunction. Home oxygen. Home oxygen should assess risk and provide teaching. Fire hazards with home oxygen. Spark-producing hazards such as toys that create friction. Contributing fire hazards such as those with newspaper collections. Chronic kidney disease leads to fluid overload and hyperkalemia. Salt substitutes contain potassium chloride, which contributes to hyperkalemia. Dietary restrictions for chronic kidney disease include salt substitutes, potassium, sodium, low protein, fluid restrictions, and low phosphorus, such as that in chicken, turkey, and dairy. Osteoarthritis, degeneration of synovial joints. Osteoarthritis manifests with pain with activity, crepitus, morning stiffness, decreased range of motion and mobility, and atrophy of muscles.